Let's go a little bit deeper, get more expert insight tonight. Joining us now is Dr. Amesh Adalja. He's a senior scholar at Johns Hopkins Center for Health Security, focused on emerging infectious diseases, the exact type of expert you want on a night like this. Dr. Adalja, thank you for being here. We know the president is still infected with COVID-19. He's an active case. We don't know the full extent of his condition, but he's being treated with steroids, an experimental treatment. He's had fluctuating oxygen levels over the weekend. Is it wise for a 74-year-old man in his condition with underlying conditions to be at home?
You have to remember that he isn't actually at a home like you and I live in. He's going to the White House where there is a medical unit where they can give supplemental oxygen, where they can give intravenous medications, where there are 24/7 medical professionals that are going to be monitoring him. And I've had patients of my own that I've discharged from home that have had remdesivir, that have had steroids, and have a similar case. You have to really just be careful with it and make sure that the patient is on a good trajectory before you do this. And it seems, at least from what we're hearing, and there are limitations to what we're hearing, that the president is on a good trajectory and he's going to a place that is extremely suited to take care of him during his recovery versus an ordinary home.
You know, I'm trying to suss out where medical reality meets messaging or diverges, because the president just tweeted out this produced video from the White House, and it has this kind of glorious music in the background. Marine One is landing on the White House lawn. He gets out. He's walking strong. He's looking strong. And it kind of has this victorious nature to it. Is it time in an illness where he is right now to declare victory?
I think I would probably wait a couple of more days before releasing that video. We want to make sure he doesn't have a slide back, and people can get a recrudescence of symptoms or worsening of symptoms. You also are going to have to deal with the recovery period before you can get really back to your activities of daily living. So I think it might be a little bit premature to declare victory. He's on a good path, and hopefully he does declare victory. But I worry about the message that sends, and if something were to happen and there is a setback, it will make that video really moot.
I want to talk lungs, Dr. Adalja. The president's doctor has not gone into detail and purposely about his chest x-rays. He said they had expected findings, but the expectations in many doctors' analyses in a patient with his profile and knowing this illness is lung damage. Would that have long-term impacts for someone with his profile?
It all depends upon how extensive the lung damage is. We know that he required supplemental oxygen, but not only transiently. So that tells me that the lung damage or the X-ray findings likely are that of a mild pneumonia, and that will resolve over some period of time. So I don't suspect that there's going to be much permanent damage to his lungs, but it is very puzzling that they just can't say that the lungs have pneumonia in them or whatever it might be. You know, the new task force leader that the president favors is a radiologist. So this is a great time for that radiologist to actually be a radiologist and talk about the president's chest x-rays or chest CT scans.
The West Wing has been inundated with new cases. I mean, you go from mid last week to now, it's something like 20 cases. And they're providing hand wipes, disinfectants. They're saying, you know, we're going to be more careful. But according to everything I've been reading, doctor, the real issue seems to be with COVID in-person contact.
Yes, what's going on in the White House is really baffling to me. It's not a safe place for journalists or people to work. It's basically a hotspot now where you have a potential or a borderline super spreading event that occurred with very little effort to really contact trace. And it didn't have to be this way. I think you could have done this in a much better way. They could have White House operations respect the fact that we live in a pandemic, but it seems to be that they still are not quite taking this seriously. And I think that if I were a journalist or a staff member there, I would be very careful. You basically have a bunch of typhoid Marys walking around there.
One more question here, Dr. Adalja, because you look at emerging infectious disease, not only the diseases that we already know everything about, and we say, okay, the cold, yes, you catch it, and here's how it works. With COVID, we don't know everything about it just yet, but the president has urged the public today, don't be afraid of COVID. And I guess he's saying, I survived it, see, it's okay. But he went right to the hospital. He got top-of-the-line care and medicines. Is it good advice to tell Americans, don't be afraid of COVID?
No, it's not good advice to tell people not to be afraid of COVID. They don't need to panic about COVID, but you have to take it seriously. And if you are infected with COVID, you may not have a trajectory as good as the president's, where you're diagnosed very early and basically have medical professionals swoop in on you very quickly and give you experimental therapies and hospitalize you and take care of you in a way that's not really normal for a patient. So I do think that it is something that people still have to be very careful about, especially if you're in the same profile as the president. If you're elderly, if you're obese, any of those vulnerable populations, this is still a deadly disease, as 200,000 plus deaths can attest to, or even people like Herman Cain who died of this that are in the president's age range. So this is something that you really still need to be very reticent about just exposing yourself to or taking very lightly. We still have a lot of work to do to get this under control.
Dr. Ramesh Adalja, thank you for joining us again tonight on Newsy. We appreciate it.
Thank you.